Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I am your host, Dr. Hal Stewart, and we're here today with episode 3 of our 3-part series in mobility. If you haven't watched the first 2 episodes, I would recommend that you do so. You don't necessarily have to do it before you see this episode, but in episode number 1, we talked about what mobility is, what flexibility is, why it's important. And then in episode 2, we talked about where we lose mobility, even starting at a young age up through adulthood, and in the different major parts of the body: the neck, the shoulders, the torso and spine, the hips, and yes, even the ankles. It was very enlightening. The ankles are very, very important in our mobility. And if we lose mobility in our ankles, it will have an effect on the rest of our bodies. So today we're going to talk about how we improve mobilities as adults and what we can actually do about this. And our guest is going to give you some practical advice on what you can start doing today. Speaking of our guest, it's happy to introduce once again Kay Sims. She's my personal trainer. She's been my personal trainer for 8 years. I also consider her a great friend and a trusted advisor as well. She is a certified trainer at Outlaw Fitcamp by Jesse James, and she has a master's degree in exercise physiology and multiple certifications. She's a CE junkie like I am in my profession. We're always thirsting to learn more. So we've got, it's been a privilege having her on the past 2 episodes, and I'm really excited about today because we're going to actually give you some advice on some things that you can do. I do want to make a disclaimer that what we're talking about today is not to be considered as an official exercise program. These are just some hints at things that you can do. We certainly recommend that you, depending on your situation, that you try to work with a professional such as Kay to get the most benefit from these type of exercises and programs. So, Kay, welcome.
Thank you.
Glad to have you back again today. Kay, the last 2 episodes, as I talked earlier, we defined mobility and flexibility, and then we talked about where we lose it in the neck, shoulders, torso, hips, and ankles. Today, let's talk about some things that our clients and patients can do to just to start, some simple things that they can do to start gaining mobility or to keep from losing mobility. And I guess like we did last week, we'll start with the neck area. Yeah.
And the first one I will add, if you currently already have an injury or issue, this is an exercise I'm going to provide for helping to maintain or restore mobility injury-free. So if you already have an issue, definitely seek out that extra help. But just in terms of general movement, starting with the neck, the ability to looking side to side, just working on maintaining that ability to look over your shoulder, look over your right shoulder, look over your left shoulder, look up to the ceiling, look down to the floor. Just by doing those movements is a really good way to keep those abilities. A lot of people may not be much down. I would say make sure you should be able to tuck your neck down all the way and not just wherever your screen takes you.
Should be able to touch your chin,
almost like
breastplate?
or at least trying to, and looking up to the ceiling, just by doing those different directions. With the shoulders, really for most people, we get so tight here sitting. So reaching up, reaching up overhead and stretching behind and doing classic arm circles like you probably did in PE class, forwards and backwards to work through that shoulder joint. And so we're doing all the way through that range of motion. If you find there's a spot that feels tight, maybe stop and hold that and just kind of try and stretch that out a little bit more.
What if you get to a point, because I know this is before you and I started working together with my multiple shoulder injuries, there were certain movements that, I'd get to a point and it would really start to hurt. So if someone's going to get there, it's not necessarily no pain, no gain on this thing. You really shouldn't be doing something if it hurts.
Correct. Yeah.
Go up to that point and stop, and maybe slowly get a little further and further, and that where it doesn't hurt.
Yes. Yeah. If it is hurting, that's your body telling you something's not right. Unless you're under the supervised care of a physical therapist that's helping you recover from something.
Right.
But if it hurts to do it, don't do it. You want to stay in a safe, pain-free range of motion.
Yes.
And so obviously the goal is to improve that range of motion, pain-free. But that is the ultimate goal, is you want to be able to do these movements, be able to move pain-free.
Yeah, it's really interesting, not to interrupt you, but when I had my last 2 shoulder surgeries, which were about 10 years ago, I had really good physical therapy at, I'll give them a shout out, Joints in Motion in Flower Mound. And I remember my physical therapist telling me, because the first few weeks it was all, just warm, moist heat and ultrasonics, and it was just kind of nice. I would take a little nap, and I came in one day and she goes, "Okay, the party's over. Today the pain begins." But it was painful because I was recovering from a shoulder injury or surgery, but it was she was controlling, and she knew what she was doing. And I couldn't have done that same thing, because as soon as that pain started, I would have started compensating.
Exactly.
And you don't even know you're doing it. But since she was manipulating my shoulder, she was just taking me to that edge a little bit and back and forth until I got the flexibility. So that's why I think, it's important, and correct me if I'm wrong, on your own, not to try to work through pain, because as soon as you feel that pain, you're going to compensate.
Absolutely.
And then it's just going to get worse.
Yeah, it's so important that you're doing it safely. And if you're in pain, you're going to try and do something wrong and hurt and put it at higher risk for hurting yourself.
Yeah,
So absolutely. Yeah.
And the shoulder is such a complex joint.
Hence they call it the shoulder complex. Yeah.
It really is. It's the shoulder complex, and it's made of multiple ligaments and muscles and bones and cartilages. And you think about your shoulder, and it can move in so many directions. It's not just like a door hinge. So it's something that really should be given a lot of attention to as we get older. I know my dad and my Aunt Doris, when they got into their late 70s, they're, because of doing so much manual labor their whole life. She was one of 9 children. My dad was one of 9 children. And they just were constantly working, and their shoulders were what we call frozen. If there are any patients like that have been told, there's no hope for you, or they're too old to get surgery, like an 85, 88-year-old woman, and maybe not in great health, or man, is probably not going to go in for major shoulder surgery.
Right.
I know today they do a lot of shoulder replacements, which, sometimes that's probably a better option, depending on how much inflammation's in there. But if someone can't do that, can they still work with someone and do some exercises to improve,
absolutely,
any at all?
I think the biggest thing, number one, it's even if they do have restrictions in their mobility, it's teaching them how to move safely and properly around those. So if there is a frozen shoulder situation where they've worked with physical therapists and personal trainers, or they feel there's only so much that they're accomplishing, especially as they're older. And some issues like scoliosis we can work on and improve around it, but there's a certain point where they may have enough damage that you can't reverse it back to what would be considered normal.
Yeah.
But there's still a lot of ways we can teach them how to move safely and properly within what their body will allow.
Yeah.
And through that, often we found they do improve their mobility a lot more than they ever anticipated. Mm-hmm. But it's so key that it's starting with where they're at and teaching them how to do it safely, because on their own they're just trying to figure it out and compensate in between and,
Right.
and restarting themselves.
And maybe doing more harm than good.
Yeah, exactly.
So the torso and spine, what are some things people can do to improve that?
Really, just do it by doing movement side to side. I think reaching up overhead, and I'm thinking especially of a desk jockey that's sitting all day long. They're never moving in different directions. And our bodies were meant, God designed us to move in all directions. And so if we're not doing that on our own, if we're not doing that in our everyday habits, we need to be intentional about it. So doing rotating side to side, reaching up overhead, maybe stretching to one side, stretching to the other. Just those alone, laying down and rotating, or lay down on your back and rotate your hips across your body just by moving in those different directions. Even bringing your knees into your chest, kind of hugging your chest, extending back, just moving all those directions, side, around, forward, backward, giving it some TLC, give it a little directional movement.
Okay. So when you're working on your neck exercises, you want your torso to be, you don't move that, just your neck.
Correct.
But when you're getting into the spine and the torso, now your neck stays straight. Now you're moving like this,
and keeping your hips square. Because if you're trying to work on your spinal mobility and your hips are rotating, all you're doing is rotating your hip. You're only adding to the direction because you're rotating your hips. Not the spine doing the movement.
Okay, so let's talk about hips. So if we want to do some things that are going to make our hips more mobile and more flexible, what are some things that people could be doing?
A lot of bringing your leg up and around, kind of making, it's really hard to do.
When you're on the floor, on your back?
Yeah, or on your floor, or even standing, just stepping, reaching, bringing your leg out and around to the side, kicking ahead, just doing kicks back. I mean, high knees in place. And just by bringing those hips up and down and keeping them mobile. A lot of elderly, if you ever noticed, they're elderly that will drag their feet, and some of that, or multiple parts of that, but part of that loss is the lack of hip strength, or mobility. It's one or the other. But mobility is definitely one of the possible factors with that.
Yeah. Okay.
And it's a chicken and egg situation too. Sometimes when you lose your strength, you're not moving them, and then the hips don't want to move, and so it's just downward spiral. Or your hips got really stiff, and now they're stiff, so the muscles aren't firing, and then you're not going to use those muscles, and you're going to lose that strength.
Okay.
So
all right.
they're and that's where having a professional, if you do have an issue, I know we're going to get to that, working with someone to help you figure out your reason for your lack of mobility, making sure it's a mobility issue, not a strengthening issue. And to identify the cause.
Yeah. Okay. That's very important, because it could just be some muscles are too weak and they need to be strengthened, and but you never do lose the fact that mobility is part of that equation as well.
They go hand in hand. So when you lose mobility in one area, like we talked about with the shoulders, the chest muscles were too tight, your back muscles are overstretched. So the back muscles need to be strengthened and the chest muscles need to be stretched. If you take care of those, that's going to improve that shoulder. That's going to, if those are the issue, that will improve your shoulder mobility greatly. So it's
all interrelated, and really everybody should be doing all of these things for all the way down the chain there. So the last at the bottom, the ankles.
My favorite, when you're sitting at your desk doing ankle rotations,
just rolling it,
just
right and left, and
I'll just do like 15 circles, as big of a circle as you can make it. It'll almost burn on your ankle, like you feel your muscles burning. But I'll do like 15 one direction, 15 to the other while I'm sitting. A great one that you could even trying to like draw the alphabet, working on controlling with the ankle, just moving it in different directions. Once again, to keep it from stiffening up. And that's what's cool, is there's a lot of great things, even if you do have a desk job, you can do to help maintain mobility in your body, such as the neck exercises, or the neck, and a lot of the others can be done even while you're sitting. So taking advantage, even if you can't get up and move like you'd like to, you still are able to move. With the ankles too, by standing near a wall, put your heel on the ground and lean into the wall, and you're able to kind of work on stretching the backside, your heel, That's another great way to look at mobility as well.
Okay.
So kind of like if you were to do a wall stretch with your calf,
Yeah.
and when you bend your knee in, that's gonna help. That's gonna fire up some mobility there as well.
Great. Awesome. Well, like I said earlier, this is not, we haven't created an exercise program for you, but giving you some helpful advice and where to get started. I would recommend that if you have mobility issues, which probably most of us do, at least most of us that are in our 50s and 60s, but even younger than that, I would recommend you get a certified trainer who knows, it's not just about pumping iron. It's about doing flexibility and mobility and training the right muscles at the right time. So Kay is certainly equipped to do that. She's helped me immensely and has just really changed my life. I was at a point where I thought I would never, be able to have pain-free shoulders. And not that they've been 100% pain-free for the last, 8 years since I've been training with Kay. I've had some injuries, but unlike in years past, we addressed those injuries and I overcame them rather than letting them sit there chronically and lead to compensation, more inflammation, and more injuries down the line. So it doesn't mean you'll never get injured, but when you do, you know how to overcome it.
Yeah. And
when you're working with a trainer.
I will add, it's by investing some time in and hiring a trainer. Even if it's just being able to, if you're only able to afford, say, maybe an assessment, have someone look at you, find out where your limitations are. Spend a little bit of time working with them, even if it's just several sessions that you can get in to get you started.
Yeah.
Whatever it is worth, because that's an investment that's going to carry you a lot further. If you miss those compensations that you're doing now and that lack of mobility, then down the road you're at higher risk for an injury, higher risk for surgeries, and then impacting your movement for years to come. So there's just a lot of good reason to spend a little time to make sure you are able to move properly. And as I mentioned in one of the previous episodes, the more we sit in our society, especially even teenagers now, it's starting earlier and earlier is poor movement patterns and compensations and poor mobility. And it's only going to be worse earlier in their life, and that we're going to see a lot more healthcare costs and everything else from all those things.
Yeah.
So it's really important for people to spend time with their health, and it also limits living your life to the fullest. And I think that's so important, a big part of it. Yeah. So if you want to live your life to the fullest, we've got to be able to move well, and that's to keep going with everything.
Great advice, Kay. Thank you so much for being with us.
Thank you.
It's been great. I hope if you haven't seen the first 2 episodes of this 3-part series, you could go to YouTube and Health and Harmony Beyond the Teeth and just look up the previous 2 episodes, and you can get the whole picture of what we've been talking about. So, Kay, again, thank you so much. It's been great. I'm Dr. Hal Stewart. This has been Health and Harmony Beyond the Teeth. You guys take care, and we'll see you next time.